This program is brought to you by South Infertility and IVF.
Hi, I'm Priyanka. I'm a nutrition specialist. And in today's episode, we're going to talk about the International PCOS Conference and the highlights. Here, we have with us Dr. Anita Mani, who attended the conference. So, Doctor, you said you went to the conference this year, and...
Yes. It was the World PCOS Conference, which was held in Seattle, and actually it was a very unique conference, because in the normal gynecological conferences there will be all the topics which are discussed, but this was purely on PCOS, and we had 42 scientists from all over the world presenting papers only on PCOS, and that too very recent. So we had all these 42 scientists, talking together, thinking together. It was such a unique experience, and this was one of the best experiences of my whole life, to be in that room with 42 scientists and thinking nothing else but science. It was fantastic, and I would love to share this information with everybody else who out there have any problems related to polycystic ovary or PCOS, or even if you don't have a problem, it's worth listening what our lifestyle is doing to us.
So what is the most interesting thing that you found out? Something that you didn't know before?
Oh, there were a lot of things actually. I think the most important aspect I felt was that where the disease is beginning. We think that we get PCOS when you are a teenager, your periods become irregular, and you have problems with excessive hair growth, which we call hirsutism, and so on, and infertility and that. But the actual problem starts in utero. See, when your mother is pregnant with you, that is the time when everything happens. So the beginning of the PCOS is actually in utero. The food that the mother eats affects the growth of the baby, and it affects the hormones of the baby. Any high level of androgen in utero can lead to the development of PCOS.
So you're telling when, it's kind of a myth when we think, oh, we're pregnant, we have to eat as much as we can. It's good for the baby.
Definitely. And I'm so happy that we have a nutrition specialist discussing this, because it is the most important time when you have to eat healthy.
Yeah, we took a survey, and the statistics were ridiculous, because most women that we interviewed said, well, we are pregnant, that means we have to eat as much as we can, it's good for the baby. And nobody really knew. It was, quite a surprise.
The funny thing is that the more you eat, if you eat anything excess, it's actually going to be very harmful for the baby and not useful for the baby. So now we know that the excessive food intake can cause obesity in the baby. It leads to conditions like high blood pressure, diabetes, even psychological disturbances. In a person growing up, this is important. So the main thing is that most important period of a person's life is actually inside the uterus.
So are you telling me if there's something wrong with me, I should blame my mother?
Definitely. Yeah, but the thing is that we need education. We need to educate women about this. There are a lot of misconceptions, and we have to, for example, in some cultures, there is a tendency to make them eat a lot of ghee, during pregnancy, after delivery. In some cultures, they feed them with around 4 to 5 kilograms of ghee or butter. It's an old traditional way of doing things, and then women put on a lot of weight after that. And worse than that, the babies get all these, and then they also become unhealthy.
What about exercise or movement during pregnancy? What do you feel about that?
I advise all my patients that you have to keep moving. You have to have all your regular activities when you're pregnant. You don't have to stop any activity when you're pregnant. So if you are dancing beforehand, you can dance. If you are going to gym before, you can do. The thing is that don't start anything new, but you can continue doing everything normally. There are conditions where you have to reduce your activities, like bleeding in pregnancy, in which the doctors might advise you to take rest or reduce your activity, but that is only in a very few situations. Otherwise, activity is important. And the most important part of the conference that I was telling about, the in utero starting, the other important thing was that most of the studies showed that there is very little pharmacological intervention. That means there are very few medicines needed for PCOS, and there are very few medicines that are effective. The most important aspect of a change that somebody can do is only through diet and exercise. All the studies have shown that change in lifestyle is the important thing. And they showed that you should not give contraceptive pills continuously. That's what we are doing now. All the gynecologists all over the world, we are giving contraceptive pills because they need to get regular period. But it is actually more harmful to give pills to get periods to the girls. And you should not give pills to induce ovulation, because most of these women come to infertility specialists. So what happens is that when they're not getting ovulation because of PCOS, irregular period, the doctors give them something called Clomiphene. See, this Clomiphene is to induce ovulation. It makes a hormonal change. Well, the studies have shown that we can give this, but for a short period. We can only give this for 6 months or maximum 12 months, because there is a higher risk of carcinoma of ovary if you give for longer period. But what happens is that I have seen patients going on this for many years together, because they go to one doctor, have a Clomiphene, they'll have it for 5-6 cycles, not successful, they go to another doctor, so they have the same thing. So what happens is that sometimes patients take these pills unknowingly for many years. So it is important that you make changes in your lifestyle with diet and exercise and other things, and take medicines the least. They recommended that if the ovulation is happening and pregnancy is not happening, after 6 months you have to either go for a laparoscopic ovarian drilling or you have to go for IVF. The laparoscopic ovarian drilling, they showed that all the studies have proven that 60% of women can get relief from these symptoms. So they start ovulating regularly, and that effect stays for nearly 20 years. So if a woman has problems, especially lean PCOS, they go for laparoscopy, and if they make sure that they have a good diet and exercise, they can live normally and can have children. So that is one thing. The other thing is to have an IVF. It's not a solution for all the problems, but to have a child, you want to try and do everything. So if nothing is working, don't take pill for many years, but go for IVF early, and then try and have a baby as soon as possible.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF.
Do you think there's any relationship between insulin resistance and PCOS?
Insulin resistance, PCOS and hyperandrogenemia, like high testosterone. This is like a triangle. So what happens is that insulin resistant causes PCOS. PCOS causes high androgen. Again, high androgen causes insulin resistance. If you imagine a triangle, you know, it's vice versa. So high androgen causes PCOS, high androgen causes insulin resistance. And again, this runs in circles. So one leads to the other. So it's like a cyclical thing which goes round and round. One causes the other and vice versa.
That explains why certain food, you know, should be restricted in the PCOS diet.
Yeah, that is the reason. That is why we advise women to have less amount of carbohydrate in the diet, because high sugars is going to increase the insulin. So I've been explaining, have less amount of carbohydrate and have low glycemic index foods. So this is the reason, because of the insulin. And we have actually an interesting thing was, there was a talk from a specialist who does acupuncture and Chinese medicine.
Oh, that's interesting.
And the studies have shown that acupuncture is effective, more effective than many of the medicines we have.
What kind of Chinese medicine was he?
They were using herbs. So I don't know about Chinese medicine, but I know about Ayurveda, which is a branch of a kind of medicine from India. And we have some herbs which will reduce the insulin resistance. So, you know, maybe Chinese are using the same stuff. So you have some, like, for example, fenugreek. It's very commonly used in Indian kitchens. So it will reduce the insulin resistance. It increases the sensitivity. So, you know, the blood sugar is well controlled. So because it's similar to diabetes, most of the herbs which are helpful in diabetes are helpful in PCOS.
That's good to know.
Yeah.
Is there any more new research that you discussed with during the conference?
Yes, plenty. Few other things. See, we had a Professor Stoff. He's doing a lot of research in USA, and he's the top researcher in the field. He's working on monkeys. And it was very interesting. I was talking to him and I was saying, like, the monkeys, when they become teenagers, they become a bit less active. Like, they are a little bit lazy. So it's like, oh, no wonder teenagers are lazy. It actually happens maybe because they are like saving all the energy for reproduction. Maybe that was his theory. What he noticed that he wanted to make some monkeys PCOS. So what he did is that he made them into two branches. One was fed normal diet, the other one Western style diet. This is in US.
Diet, yeah.
The American diet of it. He called it Western diet. So he was basically feeding them with mayo and all the stuff. So he was just making a monkey PCOS just by feeding him Western style diet. And when he took the biopsy of the ovary, all the ovaries were polycystic. These monkeys who were fed on Western style diet. So that is how the whole study was done. It was simple, just put them on Western diet.
What was the other monkey?
The other monkeys were having a normal ovaries, ovulating every month. These monkeys stopped ovulating and having periods. And they stopped having kids.
Was there any study where they used the monkeys that had PCOS and put them on a normal diet? Was there a reverse?
He tried this and reverse with the other and made these monkeys normal later. So basically what he was showing that these monkeys who that is how he made the monkeys PCOS. So they were able to study what are the effects of PCOS on the different body parts. So they did biopsy from different body parts and it was an amazing finding. PCOS will affect every single tissue in the body, from skin to brain, kidney, liver, heart, reproductive system, thyroid glands, everything. There are inflammatory changes throughout the body. So that is the reason why there are a lot of psychological effects from PCOS. We had a paper presentation and it showed that it has severe psychological impact, causes anxiety and depression, mood variations. It was shown that the PCOS is affecting every single body cell, and the effects of brain is very bad. It causes anxiety and depression in women. There are mood variations in women. And not only that, we had a dentist. We would never expect actually a dentist in a PCO conference, but she was doing a lot of study because she was finding that the women who came with a gum inflammation, we call it gingivitis, that PCOS was common.
That's
so
interesting.
what she did that, she did a study to see whether PCOS is having more gingival inflammation, and she proved that there is more.
What is the science behind that?
The science is that there is inflammation in every single tissue. And she actually went deeply into the subject. She found the chemical markers and everything, and she tried to even change the PCOS and see if they get better. They did get better.
So what exactly about having PCOS affects inflammation? How is that related?
See, PCOS is causing insulin sensitivity problems, right? Insulin resistance is a big problem, right? Because every single cell in our body needs glucose to work. So, I've explained this earlier. If you imagine a cell, it's like a fort, and you have soldiers all around. These soldiers are insulin receptors. So, you have a lot of glucose in the blood, that is lot of things outside, but the things to get inside the fort, which is the cell which needs the glucose, they need to get past these guards. These are insulin receptors, okay, these guards. So, the insulin receptor has to acknowledge that insulin is there in the bloodstream, that is outside. They need to recognize that. Only then they will allow them to come inside the cell. So, insulin makes the glucose come inside the cell, and the cell will utilize it for making energy. See, these receptors, they don't recognize the uniform of the insulin. So, they say that no, I don't know who is that, I am not going to allow them inside. So, these receptors are resistant to the insulin which is there. So, the insulin level goes up. Body tries to make, see, this is insulin, send more. So, the pancreas is secreting all the insulin which is not being recognized by the soldiers. So, the cell is not getting glucose. So, what happens? Cell cannot function. Can you function without glucose? Nobody can function without a basic metabolite, right? Just like a plant is getting sunlight to do photosynthesis and make energy, the cell needs glucose. So, the cell cannot function properly. So, what happens? Panic. So, they are selling all inflammatory markers. Something is wrong. War. So, it is a fort. So, everybody starts saying, take your gun, start shooting. Whom? What? So, there is a reaction inside the cell. That means every single cell of the body reacts because of the lack of proper metabolism. So, what happens? There is inflammatory markers and inflammation.
So, what causes this resistance that you're talking about?
It's a huge topic, and there was a huge discussion about why there is insulin resistance. So, now the theory is that the high androgen levels, androgens are male hormones like testosterone, dihydrotestosterone, these high androgen levels causes changes in the receptors. Fat deposition can cause changes in the receptor. Basically, these are all coming to molecular level, and it might be all due to some changes in the fatty things. So, the high androgen is causing insulin resistance.
And how do you get high androgens?
Yeah, high androgens are secreted from the ovaries. In PCO women, what happens is that there is a pathway, normal biochemical pathway, how the hormones are formed. Basically, the cholesterol is getting converted into androgen, androgen is getting converted into estrogen. So, this pathway works, but this one does not work. So, the cholesterol gets converted into androgen, which is a male hormone, which happens normally in the ovary, but this androgen is not getting converted into estrogen because that pathway is not working properly. The insulin sensitizing agents will allow this pathway to work. Exercise makes this work because it increases the sensitivity of the so-called soldiers I was explaining. So, these soldiers become sensitive. So, they start recognizing insulin. Oh, we are doing exercise, everything works. So, there are many things. Good diet works. So, this pathway is being blocked and you have high androgen secretion from the ovary, and that happens even in the fetal level when the baby is inside the uterus, it can happen. So, it is not just after the teenage that it works. So, the androgen production from the ovary is high in PCOS. So, you see the circle now?
Yeah. Do you think is PCOS reversible or is it something you can't get out of?
See, PCOS is not a disease, it is a physiological alteration and it is a lifelong. You have genetic predilection for that, you have it. But I think that, and it is perfectly understood, that you can keep a PCOS under control, keep the person normal by having healthy diet and exercise, healthy lifestyle. It is possible without any medicine, which is great, right?
That is great. So what kind of foods do you recommend? Just in general, what's wrong with
the main problem is that, you know, these glucose is going to cause high insulin, so you have to reduce glucose, which is reducing the carbohydrate. That's the main thing.
And what about
take
fat?
A lot of you need to take fat in an essential level, but not too high, but you need to add a lot of fiber. So, the best diet is high fiber, low glycemic food. So, it was wonderful, right? See, so we have covered a lot of aspects. I feel that we have still a lot more aspects to cover in PCOS from the conference, which I will do in another episode. Okay?
Thank you.
Thanks.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. South End Fertility and IVF,